Hello, Dr. Rothhaus. How are you?
I am fine, Miss Pinelli. How are you?
I am lovely. I heard a rumor that you got a new toy.
To whom have you been speaking?
Well, just a little birdie around the corner was telling me that something got delivered to your office that we all might be interested in learning more about.
Oh, it's that little birdie named Lisa or Juliana? I wonder.
Exactly. They said that
Oh,
you got a new laser beam.
it's actually not a laser. It's actually a power assisted liposuction device,
Oh,
and I use it in conjunction with. I use it in conjunction with. I don't know if you can see it, but this is my smart lipo device. It's
yep.
actually it's actually called the triplex because we do three different things with it. But in conjunction with that, in order, we're actually finding post-pandemic that patients are coming in and they're asking for larger liposuctions in the sense of they want more areas covered. And I think after this past year, people have put on weight on their backs, their bra lines, their sort of back of their pelvis, the so-called love handle area. They're seeing
Mhm.
it on, their waistline, their belly. So they're coming in and they don't have like a lot of fat, but they have a lot of areas that to cover. And the procedures can take a long time. And I think for safety, I'd like to, don't want it to be too long. So the power assisted device should enable us to safely remove the same amount of fat, but do it so the patient spends less time on the operating table. And also enable me to get areas that have lots of fibrous tissue, get the fat out a little easier for the patient. So my plan is I've used power assisted in the past, but I'm going to be combining it with laser. So even with the power assisted, I can use their smaller and thinner cannulas. And I think this will be a better result for the patient. So I don't know if you can see it. It's way down here already. It already has a home.
Oh, wow.
Can you see it there?
Not so well. I mean, I can see where it is, but up, roll it over.
Now do you see it?
Now we do.
Yeah, and one day I can go over all these things with you, but this is it, and it's really quite simple. I don't see where all the maybe I have one here. Never can tell what I can find. Oh, cool. So here, can you see the package and what's in it?
Yes. Yep.
So this actually is fairly standard looking type of liposuction cannula, very thin, you know, different patterns of holes at the end, depending upon what you're trying to do. They come in different thicknesses. This should be looks like a 3 millimeter to me, and it is this is actually wider. This is a 4 millimeter. Okay, and so that refers to the diameter of it. So I like to use actually ones that are a little thinner than this, 3 millimeter, and then normally with a liposuction cannula, it's sort of mechanically done by the surgeon himself. This one, the machine, there's a little handpiece that you put it into, and it moves the tip back and forth, and it just makes so the surgeon continues to move, but he doesn't move as quickly, and this sort of helps get the fat out a little faster. So it's called power assisted.
Very cool. So it sounds like you have a little Pac-Man at the front going.
Yeah, exactly. You know what? I hadn't thought of it that way, but if but now that you put it, it's exactly a little Pac-Man. That's what I am.
You just needed someone to really make it understandable.
Yeah. I am not going to call this PAL anymore. I was calling it PAL for power assisted liposuction, but I am going to call it Pac-Man. We all know. So
put a bow on it, and you've got what was it, Pac Woman or Pac Lady? What was she called? Mrs. Pac-Man. Mrs. Pac-Man. That's amazing.
Anyway.
So you've got a now power tool in your toy chest.
I have a power tool in my toy chest. Yes, that's exactly it.
Super cool. Well, thank you for sharing it. For anybody
You're welcome.
Looking to do some liposuction, whether it's on your body or face, Dr. Rothhaus has all the tools to make it a much more comfortable experience. Very cool. I can't wait to, I guess, try it on my excess butt that is now overhanging in my pants. So suck that all out. Thanks, COVID. So I'll see you soon on the operating table.
I will see you soon, Alex. Take care.
Bye.
Bye-bye.